Paul Sher, and I'm here in Somerville, New Jersey at the Somerset County Chiropractic and Acupuncture Center. And as you can see, these needles in my face and in my arms are acupuncture needles. And what am I doing? I'm here with Dr. Richard Golding, who is head of this center, and a chiropractor, acupuncturist, and very unusual for this field. He's in Chinese herbal medicine, and he uses all three, introduces all three to his clients where it's needed and what he feels is the best procedures to use to help his clients. I want to thank you very much for being on the show, Doc.
Paul, thank you very much for having me. What I'd like to do at this time, I'd like to just take a moment out and explain to you what we're doing to Paul at this moment. With Master Sher, 4 years ago, he had a condition that developed after riding an open Jeep up in the Poconos. This allowed for the wind to blow on his face, and then gradually that coldness went into the muscles and nerves of his face and developed a weakness on this side that allowed for his face to drop, the facial musculature and the nerves to be involved. This condition in Chinese medicine is known as a wind bony bee syndrome. In Western medicine, it is known as a Bell's palsy or facial neuralgia. What we're doing at this point in time is that we're utilizing acupuncture, which is utilizing small stainless steel needles that penetrate the surface of the skin. And what that helps to do is it helps to stimulate nerve and muscle regeneration and stimulates healing by increasing the hormones endorphins into the involved area.
Okay, and as you can see, there's several needles on my face and on my arms and on my hands, and there's no pain here. Okay, there was no pain with the needles going in, and I'm sure, because I've done this with him before, there's not going to be any pain when the needles are removed. So, again, thank you for being on. Is it time that you can remove the needles?
We can do so at this time.
Actually feels like a sort of a small fly or something just landing on you when they're removed. Okay, there's not a pain, it is not a discomfort, it just feels like something's taken away from the skin. I want to say that this is a very good thing that he's doing, because this happened many, many years ago, and I've been told by some medical practitioners that it's too late. After the year, all the damage is done, and this is not the first treatment he's given me for this, and it is improving my face. Those of you that saw my show 5 years ago, might have noticed that my eyes were, the one eye was pretty much closed, and now it's almost back to normal, and I'm enjoying the fact that this is really working out. I'm going to go inside now. We're going to do some more things, and we're going to talk a lot about the type of medicine and the type of medical treatment using Oriental medicine and chiropractic that Dr. Golding has put together as his program. So is it okay? We can go inside now?
Certainly. We've talked for a moment about acupuncture, but now I'd like to tell you a little bit about Chinese herbal medicine. Is that Chinese herbs is an intense system of analysis that takes into play physiological and functional representation in the body, and Chinese herbs are a material foundation for well-being. And in a few moments we'll show you some of the ways in which Chinese herbs can be dispensed and prepared for one's own well-being. Acupuncture is a tool of balance, and when we utilize acupuncture, we are utilizing the application of single-use, disposable, sterile needles into the body as a tool of balance to take energy away from an area that is what's called excess or too tight. An example of that would be, let's say a person has a muscle spasm somewhere in the body. That would be indicative of an area that's constricted, is too tight, has too much energy in it. So what we need to do is we utilize the acupuncture needles to disperse or let go of this contracture or this tightness. So we're eliminating excess or too much from a given area. There are usages upon which we can take an area that has a deficiency in a certain portion of the body and allow for that area that is depleted or deficient and bring the body's natural energy back into there, which the Chinese refer to as qi, or your body's own natural resources. There is essentially an acupuncture treatment for every given condition in the body. And that's not to say that acupuncture is appropriate, is going to heal every single thing that a person has, but certain conditions within acupuncture have a tremendous degree of efficacy to help and heal. And
could you give us some examples of what you would use acupuncture for in some illnesses?
Okay, well, in headaches would be headaches and chronic headaches, colitis and digestive disorders, people that have myalgia and fibromyalgia, women that have chronic menstrual difficulties. Acupuncture works extremely well for insomnia, which I find afflicts many, many people. It is very good for arthritis and muscular disorders. It's very good for tendinitis and frozen shoulder. It's very good for people that have facial neuralgias and neuritises of the body. It's very good for peripheral neuralgia, or people that have diabetic, what's called diabetic retinopathy, which is the decrease of blood flow and the starvation of nerves to given regions of the body. Is very good for people that have frequent indigestion. Problems that gear themselves predominantly towards functional disorders of the body can be helped tremendously through acupuncture. If it appears that a deeper analysis is indicated, then what we would do is we would move forward. And part of that process of moving forward would be, first of all, tongue diagnosis. Within Chinese medicine, we take and we evaluate the analysis of the tongue. Master Sher, let's see your tongue.
Is this allowed on this? Okay. All right. You want me to just stick my tongue out?
I want you to stick your tongue out.
That means I can't talk. That means I can't talk then, right?
For a moment. Okay. In Chinese medicine, when we do tongue analysis, what we're looking for is many different things. First of all, we're looking at the color, shape, body, and quality of the tongue. This gives us an indication of the internal environment within a person's body. This, over the course of thousands of years, has been broken down into regions of what's called disharmony within the body. You can close your tongue down for a sec. Regions of disharmony in the body that give us an indication of whether there's particular weaknesses. Also, we are checking for the coating of the tongue. Paul, if you wouldn't mind once again. He has a yellow coating to the tongue that would indicate heat symptoms within the body and give us an indication that his body is generally hot, and that may correlate with the symptoms that brought him in to see us. You may close. Another important diagnostic quality within Chinese medicine is the taking of an individual's pulse.
This one?
We're going to now, the pulse within Chinese medicine also gives us an indication of the internal environment within the patient's body, but gives us more of the functional or energetic quality of what is going on a circulatory basis. The pulse within Chinese medicine allows us to check for 27 different qualities of the pulse that give us a physiological interpretation of what's going on in the body. This pulse is taken at the radial artery and corresponds on 3 different levels to different organ systems within the body and different problems that may or may not be going on. We're not just checking for how big a pulse is or how many times it beats per minute, which is an important aspect. We're also checking for the way that the blood feels as it rolls through the blood vessels. It takes many years to get good at this particular form of diagnosis, but when one pays quality attention to this particular aspect of the pulse, you get tremendous amount of information regarding an individual's well-being.
Listen, besides the acupuncture, you're doing Chinese herbal medicine, you're a chiropractic doctor. Let's talk a little bit about Chinese medicine as you know it, as you use it, okay? How does this all come about? Some history that maybe the audience doesn't know anything about.
Well, acupuncture and traditional Oriental medicine had its origins in China approximately 3,000 years ago. Just like we have ailments and afflictions now, they did back then, and they certainly had much more limited resources to help individuals that had problems going on. So what happened was that they set up a system of observation that correlated certain symptoms and pain syndromes that people had and where areas of tendernesses may have been in their body. Over the course of thousands of years, they found that there characteristically was patterns of illnesses and patterns of tendernesses from problems inside the body that reflected themselves on the exterior of the body. They also found through touching or palpation that they could influence the way that a person felt by applying pressure to certain areas of the body. This gradually developed into utilizing instruments such as stones and tools to apply pressure into what's called acupuncture points of the body. And then they found over a period of time that these conditions could be helped much better by actually taking a needle to puncture the body to influence that point to a greater degree. This then gradually developed into a system of modern acupuncture, which found that these certain points developed and came along certain channels of the body, and we call these acupuncture meridians. These came through observations and through touching over a long period of time, and has found to correlate with a whole sequence of Chinese medicine. Up until recently, it was not deemed by Western medicine to be all that accurate as far as its anatomical locations. But what's happened in recent years, as our science has developed more, we've found out that they injected radioactive isotopes into acupuncture points of the body and found out that the isotopes went along the actual meridians of the body, thus correlating with what the Chinese had been talking about for thousands of years.
You know, I'll interject for a second. What I find extremely interesting is that the Chinese medicine, and acupuncture in particular, has been around for thousands of years. You know, we're even talking about the original Oriental medicine book, which is somewhere about almost 5,000 years ago, and has not been recognized by the West until 1972, 1974, and that time. Till then, they just disregarded it. A few people were interested, but for the most part, Western medicine and Western medicine people just disregarded it as it has no meaning to them. And now, all of a sudden, everybody's running over to China to learn all these methods that you have learned, you know, and it's gradually, not so gradually, becoming more and more accepted. I think that's great, because you're like an example of this, that East meets West, and look how much more you can do than just focusing on one thing. You know, I just want to say that because you're, I don't say you're a pioneer, but certainly only in a few years that we've been, less than 2 decades, that here you are practicing, helping people, healing people, using this combination of modalities. So I just thought that always fascinated me. It takes thousands of years to learn something that people are using.
Well, thank you, Master Sher. It certainly has taken a long period of time for Western medicine to embrace the alternative or natural concept of healing. But what we found out is that each system of healing within the world has limitations upon which it can function the best in. And for us to disavow acupuncture and Chinese medicine when it helps so many different ailments and has a whole sphere of influence that we just weren't paying attention to, it's now finally coming online, and is being welcomed with open arms by a lot of people.
You know, before we get into how you got into this, I'd like you to talk about some of the illnesses, preventive medicine, etc., that you use all three modalities or choose from all three modalities for. What kind of work do you do?
Boy, that's a mouthful there. Yeah. We utilize, I've been here in this office for 18 years, and we've been utilizing chiropractic care, which specializes in chiropractic spinal adjustments, which allow for pressure to be taken off the nerve supply of the spine through manipulation. This causes an effect throughout the course of the body. Chiropractic care, as we know it, and which has been founded in America 100 years ago, has developed into a highly specific and very scientific system of analysis and treatment. Bony manipulation, however, has been going on not to the same degree as chiropractic care, but has been going on for thousands of years in Chinese culture and has been used as a technique. And through my studies, learning that they've been utilizing that back then and incorporating bony adjustments and bony manipulation along with Chinese herbal medicine and acupuncture, I thought that the combination of the three techniques would certainly allow for a greater degree of success in my clinical practice. What I'm going to do at this time is that I'm going to demonstrate an actual acupuncture treatment. This is Susan that's here with us today. She is suffering from premenstrual syndrome. She's suffered from this severely over the past 10 years or so, and has been undergoing acupuncture treatment, which has been proven to actually totally relieve her condition. Acupuncture treatment does not hurt. Certain acupuncture points are tender to the needling process itself. Within Chinese medicine, she has a condition known as constrained liver qi, which is a frequent diagnosis within Chinese medicine that says basically bound up tightness and tension throughout the course of the body. And we're going to relieve and alleviate that through utilizing acupuncture. Some of the most frequent points utilized in acupuncture for this condition are from the knees down, the elbows down, and in the course of the ear, which is known as auricular acupuncture. The first point that we're doing here is known as liver 3. And what this does is it helps to open up the smooth flow of energy throughout the course of the body. The secondary points that we're going to be doing on either side of her body at this time is known as spleen 6. Spleen 6 is a point within the body that is a meeting point of all of what's referred to as the yin meridians of the body. This means all of the material organ-based functional aspect of the body meets at this particular point, and this is a very nourishing and strengthening point. The next point that we're going to be utilizing here is known as stomach 36. Stomach 36 allows also for the smooth flow of qi in the body, and is a very strengthening aspect towards the digestive processes of the body. The next point that we're going to be doing is in Chinese medicine referred to as kidney 3. Kidney 3 is a point around the ankle that also nourishes the yin of the body, and this is a very effective point in helping PMS to be controlled over a long period of time, not just on the given point in time that the individual is experiencing the PMS. Now we're moving up to the upper half of the body. We're going to be needling a point known as large intestine 4. This is a very powerful, one of the most powerful acupuncture points in the body. Not only is it good for her condition, but will also control all of the symptomatology in the head, face, around the sinus and facial areas. Very good for toothache, and this point can often be massaged by a person within their own home, right in the web of your finger, and frequently can help to alleviate headaches or sinusitis. It works pretty good. The other point that we're going to be doing today on Susan is known as pericardium 6. It is a point that deals with digestion and nausea. She experiences frequent nausea associated with the PMS. This particular point is very good from that. It's measured two thumb points up from the elbow crease. Very important point for nausea and digestion. Now what we're going to do is that we're going to utilize a separate system of acupuncture within the body known as auricular medicine or auricular acupuncture. Auricular acupuncture was actually developed by the French at the turn of the century, and it was found that it is known as a, quote, microsystem of acupuncture that exists within the ear. So what we're doing now is we're overlaying traditional Chinese medicine and traditional meridian-based acupuncture with auricular medicine, which takes place within the ear and is correlated within certain points of the body.
Dr. Golding, but wasn't acupuncture practiced on the ear by the Chinese before?
In general, no. It was pretty much stayed within the periphery of the body. The auricular medicine was originated by a man known, an MD known as Noger in France, who originally studied acupuncture in China and in Vietnam, and brought the foundations of this back into his study. More towards the turn of the century, when electrodiagnosis could measure the lowered resistance that is measured at acupuncture points utilizing today's existing technology. This lowered resistance of the electrical impedance that can be measured aided in the assistance of forwarding the study of auricular medicine, so that we could correlate the symptoms with the points for acupuncture, and allowed for a very expedient treatment over a short duration of time.
Okay, well, I don't want to discontinue treatment here. Go ahead.
Thank you, Paul.
Okay.
We're going to finish up and get Susan all needled up, and then we'll move on towards conclusion.
How are you feeling at this time, Susan?
Fine.
I guess relaxed, huh?
Relaxed. No pain. Just pinches. That's it.
Is she finished? Is this all the needles going to put in?
This is all of the needles that she will need for this particular treatment. The patient will normally stay on the needles for anywhere from 20 minutes to 45 minutes for a condition such as this. What will happen is that initially the patient experiences what they refer to as a little bit of a dull ache upon initially needling them. Then what will happen is a total form of relaxation will come over the body, very similar to an anesthetic quality. And this comes from the chemical response associated with the process of needling that allows for a tranquilizing effect to occur over the body. This is caused by the endorphins released through the needling process that then bring on this overall sense of body well-being, and also stimulates healing. So we have healing occurring, number one, by the unblockage of the meridians. Secondarily, the chemical change by the release of endorphins, which promote healing in the body. Third, the anti-inflammatory effect, and the release of tightness and tension in the constricting areas impeding flow.
Great. Now, well, we're not going to leave them in there for 45 minutes because it's a show, it's only half hour, right? But normally that's about what this would take?
That's correct.
Okay, now is this, she's here for a PMS problem. Is this it, what you just did now when they removed, and it's over, or is it a continuing thing?
A patient such as Susan may experience a few acupuncture treatments at a frequency of one acupuncture treatment a week for anywhere from 3 to 4 weeks. Then she may undergo an acupuncture treatment once a month for anywhere from 1 to 3 months, and that would usually be enough to conclude the treatment with some adjunctive internal Chinese medicine, which would be the total summary of the treatment. A person may receive either anywhere from 4 needles to up to 50 or 60 needles, depending on what it is that we're treating. Also, we'll utilize laser acupuncture if necessary. We'll utilize electroacupuncture, which applies a small electrical current to the needles, which will then enhance whatever effect it is that we wish to occur in the body.
Well, I want to wish you good fortune here, okay, with your PMS, and you look so tranquil, though. You really do. Even you weren't that nervous before, but you look so almost sleeping with your eyes open. That's so nice. There's no frowning. There's nothing. Anyway, let me say thank you again. I say thank you to Susan, okay, for being here and helping us out with this. Otherwise, you would be picking on me all the time, right?
Well, you're more than welcome, Master Sher, and I appreciate you very much taking the time out to come to the office and and share your time with us.
Well,
thank you very much.
Okay, this is Asian Culture in America, and I'm here with Dr. Richard Golding of the Somerset County Chiropractic and Acupuncture Center here on Main Street in Somerville, New Jersey. Again, thank you, and thank you, Susan. And of course, I'm Paul Sher.